Thank you so much for your interest in the GO2 device. The GO2 device is unique amongst any performance-enhancing device on the market today. We use the known scientific principle of PEEP and a patented mouthpiece that serves to give the user positive and expiratory pressure. Positive and expiratory pressure has been used in healthcare for over 60 years in order to improve the oxygen levels in patients. Our initial theory was that PEEP would also be beneficial for the sports and endurance athletes. Our scientific data performed at independent medical tests showed a 4.1% improvement in VO2 max and a 6% improvement in TTE or endurance. The GO2 mouthpiece works by giving the user positive pressure on expiration. What that does is it dilates the alveoli, or the small air sacs in the lung. It thereby increases the amount of oxygen in the blood as more of the blood that circulates through the lungs is exposed to air. When you and I breathe, there are many alveoli, or small air sacs in our lungs, that get collapsed. It's a normal process. It happens to every single one of us. The GO2 device reverses that and opens up those parts of the lung that are doing you no good. It thereby increases your oxygen levels, and that's how we are able to improve VO2 max and endurance in our athletes. Our studies were all done at an independent medical lab who had the goal to try to prove us wrong. But the reality was our device was so effective and so consistently effective that every single one of our test subjects improved all their parameters. For you, the athlete using it, I will want to give you two pieces of important advice. First is the 3 S's. There's initially a suffering, where before and afterwards you stabilize, and then you succeed. When you use the device, though it gives you an initial improvement, it takes a little while to get used to, so you have to be patient through that process. It's our experience that it takes approximately 5 uses before you become comfortable with the device. After about 10 uses, you don't want to work out without it. The other issue is the device does make some condensation. If I were to take a mirror and breathe on that mirror for 2 or 3 minutes, that mirror would become wet with condensation from the exhaled water vapor in the air. What happens is, as you breathe on the GO2 device, water condenses on the valve. Now the good thing is, a good portion of that water is swallowed back, and you therefore become less dehydrated when you use the device. But there is some condensation that comes off the valve that the user needs to become familiar with and comfortable with. First, we ask you not to clench your teeth while you use it, as that will decrease the amount of water that you swallow and increase the factor of the condensation. Second, you need to take it out periodically, to swallow, to take a deep breath without it, in order to try and clear that saliva, as that will help make the GO2 device more comfortable for you. We're excited that you've come to join us on this incredibly new adventure to try to improve performance athletes in a scientifically proven manner that's safe and effective. Thank you so much for your interest in the GO2 device.